Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. Okay, so in this video we're going to talk about how to identify the three most common types of skin cancer. Now, skin cancers generally can be divided into two groups, and that's the non-melanoma types and the melanoma types. In the non-melanoma group we have basal cell carcinomas, which make up about 80% of skin cancers, and we have squamous cell carcinomas, and those make up about 10%. In the melanoma group we have what we call malignant melanomas, and they make up the other 10% of skin cancers. Now, fortunately, the non-melanoma types, that's the basal cell carcinoma and the squamous cell carcinoma, they're more common, but they're a lot easier to treat and they're a lot less aggressive. Malignant melanoma, on the other hand, is potentially a lot more serious, and unfortunately rates of malignant melanoma are rising, particularly in younger age groups. By far the biggest risk factor for developing skin cancer is sun exposure, and be that from direct sunlight or through the use of sunbeds. Now, early recognition and prompt treatment of skin cancers is essential, and we're going to talk about how each one might present. Now, basal cell carcinomas, first of all, these can either develop as a pearly, waxy white lump or as a flat, scaly skin patch. And these patches can actually grow to quite large. They can grow to 10 to 15 centimetres, and characteristically they do not heal. Now, these tend to develop in sun-exposed areas, for example on the face, on the ears, on the neck, upper chest and the arms. Squamous cell carcinomas start off as firm red lumps, and again these can appear in sun-exposed areas such as the arms or the neck or the face, but can also develop in other areas such as the genitals, in the anal region as well. Now, the third type is malignant melanoma, which can develop from either an existing mole or a new mole altogether. Now, fortunately there is a very clear-cut rule that you can use to identify whether a mole is potentially serious, and that's what we call the ABCDE guide. And we're going to go through that one by one. So first of all, A stands for asymmetry. Normal moles tend to be symmetrical and one colour throughout, whereas malignant melanoma tends to have two halves to it or can be varied in appearance. B is for border. Malignant melanomas tend to have a very irregular or a scraggly border, and that can point you in the right direction that it may not be something as benign as a mole. C is for colour. Now, serious moles tend to be variegated in colour. They can be made up of more than one colour and often are a combination. D is for diameter. Now, malignant melanomas tend to be over 6 millimetres or 1/4 of an inch in size. And E is for elevation. Moles that are serious can be raised away, up from the skin, so they may appear as more of a bump than just a flat mole. Now, always remember that if you have a new skin spot or a mole that's developed and you're worried about it, then you must seek help. If you've got a new skin lesion that doesn't heal after 2 weeks in particular, make sure you go and see your doctor to find out whether it is one of these potentially serious conditions. To be honest, prevention is the key, so make sure you watch your sun behaviour and protect yourself by using sunblock. And that's how you identify the three different types of skin cancer.